your hip replacement, there's some bathroom safety tips. And one of those is to have a high enough toilet so that you're not breaking your hip precautions. Remember, we have to have a wide open angle on our hip and not have our knee above the hip. So if you have a low toilet, it's hard, one, to get up from the toilet, and two, your knee may be above your hip. So one way to combat that is to have a raised toilet seat or a commode over your toilet. So we're gonna demonstrate having a commode over your toilet, and you always want to take your walker in with you. Don't leave it out of the bathroom. But if you just bring it in and turn with it, and then once you feel your leg on the toilet seat, reach back for the handle and slowly lower yourself down. If you need to, you can kind of bring your foot forward, but mainly just slowly lower down. And when you're sitting, your hip should be higher than your knee. So when you're all finished and it's time to stand up, have one hand on the handrail that you're pushing up from, and stand and grab onto your walker. Once you're standing with your walker from the toilet, make sure you keep your walker in front of you as you go to the sink to wash your hands. You don't need to leave it to the side. You always want it in front of you. You can step up a little bit in it, but then you can wash your hands, keep one hand on if you need to for balance, and then switch. You could even kind of use the sink for a little bit of balance if needed at that time. And then once you're done washing and drying your hands, again, keep the walker with you as you step out and turn to exit the bathroom. One of the keys to a successful outcome after your surgery is to follow your hip precautions if you were provided some by your orthopedic surgeon. So with that, you got to think about safety in the shower or bathtub. We always want to have non-skid surface on the bottom of the tub, and then if you have a shower, you can get a shower chair for a walk-in shower so that you have a place to sit. If you have a tub, a transfer tub bench is the best recommendation. So we're going to demonstrate a transfer tub bench. Again, always bring your walker with you. Don't leave it behind. You can back right up to the tub. Now the transfer tub benches are longer and they have the two legs that come outside of the tub to allow you to back up to it and sit down. Again, you want to make sure you have the nice wide angle at the hip, which is often challenging to step over the tub and not bring your knee up higher than your hip. So these tub benches are pretty necessary after you've had a hip replacement in order to ensure safety and a good outcome. But once you're seated, you scoot over and turn, and then while you're sitting, you can then bring your leg up over the tub and your other leg without having to stand, and then scoot over. Having grab bars in the tub is also a really good idea in the tub or shower, just to kind of give you that little extra added support especially when you are ready to stand while you bathe. So then to get out, you just do the reverse process. We're gonna scoot over to the edge, and then you're gonna pick up each leg over the edge of the tub. If you have a really high tub, you may need to lean back a little bit in order to keep that angle open, but you can safely do that in the chair without losing your balance, and then have a little bit more room to bring your leg up and get it over the side of the tub. So now we're outside of the tub. We're not slipping and sliding in the shower because we're standing up, so this is a much safer alternative. And again, we're gonna push up with one hand and grab our walker and leave the bathroom.